And we're at Bullpen 2024 during Biotech Week 2024. And I'm here with a team from Sequoia Biotech Consulting. We have Kim Bennett, Jennifer Kilroy, and Gregg Sherman joining us. Welcome, guys. I'm so excited to get a chance to sit and talk with you about everything you're doing.
Thank you.
Thank you. It's great to be here.
All right,
Thank
well,
you.
I've got a few questions for you guys, and I want to give you each a chance to weigh in when you want to. And so I'm going to dive right in if that's okay.
Absolutely.
All right.
We're ready.
So my first question is, what advice or perspectives can you and the team from Sequoia Biotech Consulting offer life science and healthcare companies as they navigate their AI strategies, which you can't have a cup of coffee without hearing about AI anymore, whether people are afraid of it or embracing and running full steam ahead. So what can you do in that space?
That is an excellent question and so true. You hear about it every single day in everything you're doing. And we hear about it internally, we hear about it externally. And so one of the things I think is most helpful, because people are wondering, how do they get started? How do I do this? And part of it is just start with a policy. Start with what you want it to do for you and how you want your employees to use it. So think about what's the scope of that usage. What do you want them to do with it? What do you not want them to do with it? Make sure you understand some of the compliance around that. So with the EU, there is an AI Act that was recently developed. And so making sure that if you are working in the EU, you're considering that. China, any of the regional areas may have their own AI policies. So incorporating that into how you use it and what type of information you're going to be putting out there is very important.
Nice. Jen, do you have thoughts on this?
Yes, I hear a lot about AI. And for those people who know my area of work, I really focus on people. And so while I love AI, I'm really passionate about human intelligence. And so what I'm interested in is how can we bring a better customer value proposition by augmenting human intelligence with AI in healthcare. So I think one of the things that I'm looking for is a method and a way to help our clients to uncover the customer in this journey, right?
Oh, wow, yeah.
Because if we don't start with the patient and the customer in mind, then our tech strategy cannot be aligned with our value. And that's, I think, where difficulties might come. So really the first is focus on the customer. I think secondly, we need the C-suite working together, okay? I don't think the CIO ever wanted to be the chief of culture. And that's where we're heading with AI if we're not really thinking about how and where are we embedding AI in our organizations and how does that impact our employees. So how do we get the C-suite collaborating, cross-functional collaboration, so that all the functions are having a voice in how AI is going to shape your organization?
Well, I think that's really forward thinking of you, because what we're hearing already is that soon, 5-10 years, no one's going to mention AI because it's just going to be everything. And the people who have used AI are going to replace those who don't. AI is not going to replace us, but it is that, and I heard it called a tool, but more people call it like a junior colleague or an intern, because you want to treat it nicely in case the robot overlords take over. You want to know you were their friend. Absolutely. But I love that you guys are helping companies and organizations to do that.
Yes.
Gregg, what are your thoughts?
Yeah, so at Sequoia, I just wanted to mention also that we have, we've been having working teams and groups talking about AI and looking at that and how we can apply that to interactions with our clients. So I come from a compliance and quality kind of perspective. That's sort of the delivery I do for clients. So around compliance and quality and regulatory, from an AI standpoint, I think if you're going to be engaging in AI, I think the first place you want to start with is really to be in compliance with any regulatory standards and those expectations. Now, I know it's evolving, so there's nothing, it's sort of coming up, and there's a lot of documentation and papers out there and a lot of good thinkers writing a lot of good articles around it. So when you think about compliance with regulatory standards, you can also think like computer systems, validation and controls and those sort of things as you're applying those standards, so you don't get too far ahead of sort of the AI and what's going to be accepted by the industry. And then along those lines, when you think about compliance with AI, there's always data integrity and security, which if people are using it every day in their organizations, and how to control that, how to think about it, access controls. In the space of, let's say, clinical and development, you'd want to think about patient privacy and HIPAA, maintaining HIPAA requirements. But how do you control access to the tool of AI? Where do you store your data? And those sorts of things as well.
I think that's amazing, and the fact that you all had such a breadth of perspectives in your answers shows a lot of the value that Sequoia Biotech Consulting can bring to people. It's what I look for when I'm looking to work with people, so I think that's great. I'd like to turn the corner a little bit and ask another question about AI and the life science industry as a whole, and the investors and investments being made to further drug development. How do you think AI is going to impact that aspect, that investment realm in drug discovery?
I can start with
Yeah,
what
please.
we're seeing. So, in Sequoia Biotech, we have a front row seat on our pharma, med device, diagnostics, biologics, and more recently, cell and gene therapy, right? And despite the disparities and differences across all of those industries, one thing we're seeing consistently is a shorter term strategic planning horizon right now. There is a tentativeness around where to invest, how to invest, and how to organize our organizations. And you're seeing some organizations take their opportunity to reorg, to rethink how they manage their organizations, invest in information systems and data specialists in preparation for what's to come. But I think that it's, a very near-term focus in the industry right now. And that's creating opportunity then for players who are coming from tech into biotech space, right? And it's fair game. And that's why I think that the really critical part of AI right now is focus on your customer value proposition, because if you're not, maybe one of your competitors or these new startups are. Yeah.
Are there any trends you're seeing in how people are doing that, or is it kind of not a one size fits all?
Yeah. I don't know, Kim, have you seen any specific trends in technology space?
I have. What I have seen is quick adoption. And you see it particularly. And what I noticed is that some companies, some of our clients are all in and doing everything they can and being on that bleeding edge. Others are sitting back, I think, waiting to see what's happening. And then there's also the smaller ones. So it can be easy to get into the space of AI because there are so many developers out there that are developing AI. They want to be the next latest break in doing something. So if you think about drug discovery and accelerating that, there's so much data out there and people don't even know what to do with the data that they have. And being able to create, I call it it's a digital twin, but it's like, it's the model of the human and biologically recreating them so that we can accelerate our clinical trials. And the efficacy used to be, if you have a 70%, 80% efficacy, that's a great trial. Now the bar is going to be much higher at likely 100% at some point, because you will have expected to make sure that the cohort who's going to your clinical trial has gone through your AI engine and you know exactly who you need and exactly what that drug will do for that patient.
And especially the ones that won't do something for people, and you're helping companies then not give things to people that they don't need and actually get to the right therapy, which can really impact quality of life and the ability to stay alive, which I think is incredible.
Exactly. You definitely minimize any of those symptoms that you don't want.
Yeah, great.
Yeah, when I think about drug development and the dollar sort of spent there, I'm always coming from the compliance and quality system side of things. So there's those pesky things that you have to do along the way. So I think, using AI in that area really helps to focus the dollars towards like real, I would say the more focused drug development piece. So, enhancing the way you establish, implement quality systems using AI, consistency and standardization of like validation protocols, or supplementing kind of that human interaction with the systems like quality metrics and change control and deviation. AI can really play a big part in that and help to get you answers quickly to make more quality decisions using AI.
Absolutely, absolutely. And so my last question for the Sequoia Biotech Consulting team, are you ready? I got it here. Yeah. I want to know how you envision your company and other similar organizations, but more importantly yours, because that's what we're here for today. How can they leverage AI to offer acceleration in that clinical and commercial combination strategy? How do you pull those pieces together and really move the whole organization forward?
I'll start. I think where to start is what you have to think about. And a lot of people think AI, just what you said, you think about it every day. It's part of your life now, of what we do and where we move. And I think companies or clients need to look at it that way too. It's not creating everything just for AI. It's how do you integrate AI into what you're already doing? How do you integrate it into your drug development? How do you improve your business processes using AI? And I think if people are looking at it that way to help what they already do, I think that's better than trying to think that it's going to, create something over here and you're going to have a separate organization or a separate business unit that's all going to be AI. It's going to be part of everything that you do, and figuring out how to, I would say there are risks associated with it, understanding what those are from a patient perspective, from an employee perspective.
But don't silo it off, which I think is really important. It gets to a lot of what you said, Jen, is that it's about the people. and the people tied to that tool, that resource of the AI. And so what thoughts do you have about that? And how could you convince people? And I guess some of your clients, probably not everyone's bought on board. How do you get the people who are perhaps a little more fearful on board with the strategy?
Yeah, that's a great question. So if we think about AI transformation, it's a change. It's a big paradigm shift, but it's a change. And I think that organizations are at a crossroads. They can go down a path where they take a model of designing and implementing AI from top-down perspective and treating this like we did, to be honest, the industrial era with the implementation of equipment and automation, or even more recently, enterprise systems. And what that drove on the back end is the need for a lot of change management, including a lot of waste left in the processes, because the software experts can't always know the process detail. So I think the opportunity this time is to engage the workers, engage the staff, engage the employees in how they redesign their jobs with AI. And
Absolutely.
so the World Economic Forum has a big resource on job redesign, and it creates opportunity for folks to reskill. It gives them a path forward instead of being fearful of the change, but to actually think about their skills and how they can be ready for the change. So I think if organizations can engage their teams, engage their employees in being part of the change and setting forward the path for AI, that'll be a much easier journey for organizations. And I think that those ones are going to innovate the fastest right now.
And is that something where your team can jump in and help with that as well?
Yeah,
that's
we
great.
love to do it at all levels. So from the change management side, but more specifically, we like to be involved in the operating system overall design. So instead of thinking about, well, how do we bolt on AI, as Kim described, not having it something separate, instead of that approach, what Kim is suggesting is, how do we build the operating system to include AI? And I would say purposeful AI specifically.
Oh, I like that term.
Yeah, purposeful AI, because there's a lot of dumb AI going to be out there as well.
That's very true.
And not to segue to Greg on that, but Greg, what thoughts do you have? Not because she said dumb AI, because she said purposeful AI. And that's why I'm segueing, just so we're clear.
To echo Jennifer, when you think about the use of AI, especially within systems, I think there's always a component of the human component. I think it helps accelerate, instead of somebody having a volume of work in front of them, AI will help facilitate and accelerate that. So they're validating information, they're checking it, they're ensuring that whatever AI is giving you as an outcome is correct. So I think it takes a lot of the burden off organizations to really focus on the things that are important.
Yeah. Well, Greg, Jen, and Kim, before we close out, I want to ask, so say there's a company out there who's struggling with AI and how to implement it into their processes. What's your advice to them? How do they reach out to you if they need help?
Great question. So I think, first of all, we're very much embedded in the biotech space. So we might already be working with your company and we might know someone that you know. So that's the first thing, ask your network. We have our website, sequoiabiotech.com.
Perfect.
And you can drop a question in there and we'll get back to you. We have an awesome team who are very responsive and they do a great job of matching up, the right person for your questions, because AI is not just impacting. I know we've talked a lot about the leadership space today because that's the emphasis of our event here at Bio, but it's impacting your engineer who's trying to do automation validation on your production line. So we have a whole area around tech ops, as well as scientific operations, lab spaces, and quality, as Greg mentioned. It includes not just the FDA strategy, but also, your documentation, and we can help with that.
Yeah, absolutely.
All right. Thank you guys so much. So Greg, Jen, and Kim, I want to thank you guys once again. I want to point out, Sequoia Biotech Consulting is here to help you if you're struggling with any of these issues. We've got the website. You can probably also find them and lightly professionally stalk them on LinkedIn, learn a little bit more about their backgrounds. Thank you guys so much for coming down and spending time in the bullpen, and I hope you'll do it again.
Thank you.
Thank you, James.
Appreciate
Thank you.
it.